So thank you so much, everybody who have joined already. It clearly shows to join at such a late hour, the hunger for knowledge. And I'm so glad to connect with Dr. Manish Bhatia, sir, specifically after reading his books on lectures of organon of medicine. I don't think he really needs any big introduction because you all already know about him. But still, if anybody who doesn't know, let me introduce you to him quickly. Sir is postgraduate with merit from University of Central Lancashire, UK, and he is also founder and director of hpathy.com. He's from Jaipur. He has his own clinic and he's founder of Asha Homeopathy. And of course, you can go to his website, www.drbhatia.com, where you can get to know a lot more about his achievements. And one very most important point that I just discovered today while I was talking to him is that for 16 years, he has been treating cases of autism and probably has treated more than 1,000 cases. And with such rich clinical experience, I'm sure we're going to get a lot of insights today on how we're supposed to go ahead in managing autism. So thank you so much, sir, for connecting with me and all of us today. Quickly to briefly introduce me, I have completed my MD Home Psychiatry in 2012. After that, I've got training in various psychotherapies formally and extensively. So I am located in Pune and practicing since last 10 years, core into the homeopathic psychiatric field, where I'm integrating both homeopathy as well as various psychotherapies for my patients from all age groups. And also I'm professor at Dr. D.Y. Patil Homeopathic Medical College, and sir is also into teaching field, with he also being associate professor at Jaipur. So, so before I start my questions to you, sir, let me just quickly brief all of us or just have a recap about what autism is. So if I want to diagnose a child or even suspect that a child might be having autism, DSM has given some important criteria to check for. And those criteria belong to two important domains. The first domain is the social communication domain, wherein we can see that in a child as young as 2 or 3 also, there are definite social communication skills lack, wherein they have difficulty in social emotional reciprocity, failure in back and forth communication, lack of eye-to-eye contact, inability to understand and maintain and develop relationships and in their age-appropriate manner, deficits in non-verbal communication, both expressing and understanding it, and lot many more. The second domain is the behavioral domain, where you see repetitive fixed behaviors in children, very different kinds of ways to express themselves. They have self-stimulatory behaviors, they have stereotypical behavioral patterns. They find it difficult to change from one routine to another. You will find hypersensitivity or hypersensitivity issues in children when it comes to tolerating food, clothing, noise, and almost every sensory stimuli, and lot many more. That is why today we call autism spectrum disorder and not just autism, because you see variations in the presentations that a child gives, and every single case of autism is qualitatively as well as quantitatively different. You can, of course, go into your textbooks and read through the detailed symptomatology. One more important perspective that we have today with autism is that since last few years, we stopped viewing it as a disease per se, because we say it's a neurodevelopmental disorder in a growing child, which means that a child's brain who is having autism develops differently as compared to all our other brains. So their wiring is different than ours. So that is why we don't call them as diseased, we call them as neurodiverse people. Right? This is important to know, because only then we can understand the basis of the conventional therapies that we have, starting from ABA to occupational therapy, remedial education, sensory integration, all of these focus in rewiring the child's brain in such a way that those improper disbalanced wiring don't exist, and somewhere they develop those skills via proper rewiring of the brain, so that then they live a productive and a socially engaged life. So this is what in brief our modern perspective is. Sir, would you like to add on anything if I have missed out?
No, primarily from the modern medicine perspective, this is a fairly good introduction to what autism is. But what in layman terms, I would rather like to add here is, and even for the very young students who are joining us today, that most of the time the people come to us with a very common complaint कि the बच्चा अभी तक बोल नहीं रहा. The child
Yeah.
has not started speaking yet. That is often the first and the primary concern of most parents who come to the clinic. And
Absolutely correct.
that is where the diagnosis part starts. And only if you have a trained eye that you can differentiate a case of developmental delay from case of mental retardation from a case of autism.
True.
And so this is what we need to understand, that there are areas where you can actually very clearly differentiate a case of mental retardation or Down syndrome from autism. And there are cases where too many things are happening at the same time. A child which has autism along with ADHD, along with mental retardation, we even get those complex cases. So it's not just, as you said, that it's not just one disease. It's a whole
Correct.
bouquet. It's a whole spectrum. And that is why we need to understand that when we are treating autism, uh, often there are no two children alike.
Yeah.
They all have some
Absolutely.
common denominators. They all have some common denominators, but each child has or her own unique deficits, and which need to be addressed specifically. So the therapies are also very individualized, and homeopathy as itself is an individualized treatment option.
Yeah. Correct. So true, sir. And I think having said that, I would like to now get to my first question, which is that how do we view autism today from homeopathic lens? Like, can we sort of understand it via Hahnemanian classification of these or diseases, or what Hahnemann has given, his classification or understanding about diseases? How do we see it through homeopathic lens?
Any disease can be still understood in terms of what Hahnemann has written. What Hahnemann has written in terms of mental health issues and psychiatric issues. Uh, Now, there is an ambiguity in terms of whether we can call this disease or syndrome as a mental health issue per se. But considering that most of the areas where the deficit lies are on the mental front, we'll rather put it not in a corporeal disease. The more apt classification would be of mental disease.
Right.
It's not a true psychiatric disease per se. It's definitely a neurodevelopmental issue, but the plane that is affected is related to mental health. So the classification that will fit in will be of mental health issues. And where does that classification exist in homeopathy? It's between aphorism number 210 and 200, number 30.
Correct.
And within those 21 aphorisms, what Hahnemann wrote was that psychiatric ailments are of two types. One which begin on a corporeal plane, and he believed that majority of psychiatric issues, mental health issues, begin on corporeal plane, and gradually the physical health issues become less and less and less, and the mental health issues become more dominant in such a way that it looks like a one-sided mental health disease. Whereas it is actually a corporeal disease which has settled more on the mental health plane. And the second issue where he has mentioned that it's other type of disease which are truly psychiatric in nature. So
Yeah.
this is the basic classification, and I believe the first aspect is where autism lies, because
Yeah.
autism is not just a disease of the mental plane; it is a disease which affects the person as a whole. I'll
True.
give you an example about that. There are so many children with autism who also have issues related to digestion and constipation. So you can see it's something that is very common. They have their own food sensitivities, reactions. So we know that this disease is not affecting the mental pain alone. It is affecting the whole person. The physical aspect is also affected, not just the mental aspect. The mental aspect dominates. So we actually, when we are speaking in homeopathic terms, the old classification works very well. That it is a disease which is corporeal in nature but affects the mental plane more. And
Correct.
What Hahnemann has written in aphorism number 217 is that whenever you come across such a disease, the treatment has to be based on the totality. And when we say totality, what we mean is that we have to take the mental symptoms as well as the physical symptoms in consideration in togetherness, in totality. Only then we are able to find the right remedy. Then in aphorism number 224 and 226, Hahnemann writes about the role of counseling, psychotherapy.
True.
So even today we are using all these tools as part of psychiatry, as part of counseling, as part of different types of therapies. Even with children who are autistic, we are using these tools, counseling tools and therapy tools. What is this? This is what Hahnemann has written in aphorism number 224 and 226. The kind of therapies have changed, but the gist of the words of Hahnemann are still very pertinent, very pertinent. So what Hahnemann has written is that you take the totality of the physical and the mental symptoms to figure out what remedy a child would need. And then in aphorism number 221, he had written that whenever there are acute episodes in a psychiatric case, you need a different remedy. For example, a patient who is into say an anxiety depressive patient for some reason goes into paronia.
Yeah.
Now, in that acute state, you need an acute remedy. That is what Hahnemann has written. And once the acute state is over, you go into again your chronic state. This is what we see even in autistic children. Autistic children also at times go through a lot of acute stages. There are phases when they will become suddenly, some of them, not all of them, suddenly they will become very violent, very aggressive. And that stage might need a different remedy. So it's like, in general, also Hahnemann has not written that you need one remedy in classical homeopathy for life. In autistic children, I have seen that it's very often required that we need to change the remedy as the symptom picture changes, and the symptom picture changes very frequently.
True.
Very frequently. We are going stable with a remedy, and then the child hits an acute, for example, the child gets a fever. And after that fever, you again see a regression in certain set of symptoms. And that's, once the symptom picture changes, we again need to change the remedy for that child in that state. And we might come back to again the old remedy, but we might never come back to the old remedy.
Yeah, right.
So this is what Hahnemann has written, and I believe that largely the guidelines remain perfectly applicable even today. The principles do not need to be modified to suit autism.
Yeah.
The principles are largely okay. You do need to add your understanding of modern medicine, prognosis, diagnosis. You need to understand the general management of those cases. That I believe is very, very vital, very important.
True.
So that needs to be added, but that doesn't change how homeopathy works in these cases.
Yeah, right. That's true. So yeah, as you rightly mentioned that autism can very well be understood via Hahnemann classification of diseases as well, and hence the management too. I was, sir, wondering that when we talk about any clinical problem, we always think of the causes. So there has been a big debate about vaccines and autism when it comes to causes. Now, in the literature that we have today in modern medicine, they have sort of denied that no, vaccines don't cause autism. They have identified some definite risk factors, but haven't yet been able to exactly pinpoint that, okay, this is the cause and this is the effect of as autism. So in your practice, or from whatever experience you have gathered, how much do you think vaccines could be really responsible? And can we have any more theories into understanding of causes, or any definite idea about causes of autism?
Now, what I would like to add here is that whether vaccines contribute to autism or not can be debated.
Yeah.
Now, the existing commercial pharma complex has huge financial stakes to actually deny any role of vaccine in any disease. We can see this in COVID also.
Yeah, true.
All right. So the pharma companies which are promoting vaccines, they have their own vested interests.
Yeah.
Today, we know that most of the scientific papers which are related to this pharmaceutical research are often funded by the same company which is producing that medicine or that vaccine. So there is, it's not that we should accept whatever the pharma companies are rolling out with a blind eye, or whatever they are stating is as truth. We should keep our eyes open, and we should assess each case objectively. What I've seen is that there are primarily two types of autism that we come across. Uh, One, what I call as linear autism. You see autism symptoms right from the beginning and it's continuously developing. And another is what we call, in very general terms, regressive autism. In regressive autism, what happens is that a child, after having a very normal development till the age of anywhere between 16 months to 25 months, 30
Yeah.
months, uh, this for this duration, the child would develop normally. The child would have normal eye contact. The child would have normal named response. The child would be learning everything. The child would be showing all emotional expressions. The child would be start developing language. The child would often start speaking two word, three word sentences also. And then something happens suddenly that this child becomes autistic. Now, what I see is that for regressive autism, vaccine might have some role.
Right.
Because
Yeah. Makes sense.
we should not deny the observation of the parents whose children are autistic. And there are
Hmm.
millions of parents out there who say that my child was developing normally and I gave this child MMR vaccine, and the next day,
Hmm.
I've seen those cases. It's
Okay.
not like
Interesting.
there is a sudden shutdown of sudden neural shutdown.
Okay.
It's
Yeah.
not like you give vaccine today and after 2 months something happens.
Uh-huh.
No, I have seen case reports where today the child has been vaccinated and tomorrow or day after tomorrow the child loses eye contact.
Correct.
So in a certain percentage of cases, it might be happening.
It is possible. Okay. Yeah.
It is possible, but I do believe that it is not the sole cause.
Yes. Agreed.
The reason for that is because I see a very diverse window, even in regressive autism.
Okay.
Now, the time period of MMR vaccine is fixed. But I
Yeah.
see cases who are becoming autistic a couple of months before that also, and many, many months after that. So it's very difficult to say, no, every case of regressive autism is because of MMR vaccine or any vaccine. Even DPT vaccine is implicated in a lot of cases. So I won't go to that conclusion, but I do feel that there are some valid cases where we need to inspect further. There are some
Right.
scientific studies also how it happens, but that will become too technical, so let's drop that.
Yeah. No.
There is one definitely possible etiology that I feel is very, very important.
Mm-hmm. Right.
I had been researching when I started treating autism. That was somewhere around 2006.
Okay.
All right. Uh, the rate of autism in India was probably around one patient in 1 lakh.
Yeah.
And the situation was such that in my city, most of the pediatricians had never heard about autism.
Yeah.
In probably whole of city, there was one doctor who knew about autism
Correct.
because autism was not there. Had the disease been there, had so many children with autism been there, it would not have escaped the eyes of all these pediatricians.
Absolutely. Yeah.
They didn't know because there was no case, or
No
there were
case.
hardly
Correct.
any
True.
cases. So then what happened from that 1 in 1 lakh ratio? Today in India, the ratio is 1 in 100.
Yeah. A
That means
massive
in
rise.
last 60, 1000%,
Yeah.
1,000 times rise, 1,000 times rise in only 16 years.
True.
Even in US data, if I tell you, the US data was probably around, if I'm not mistaken, somewhere 1 in 350 or 1 in 400 cases back then. It was
Huh.
very high even then. But today is 1 in 36.
Oh my God. That's the US
Yes.
data. Oh God. Yeah.
The latest US data is 1 in 36 children is being diagnosed as autistic.
Yes.
This kind of explosion you cannot simply explain by, oh, earlier these children were not just getting diagnosed.
Yeah. True.
This is often what we hear.
Yeah.
But it's not simply possible to miss such large volume of patients. Had they been there, they would have been noticed. They were not noticed because they were not there.
Not there. Correct.
So now we have to think in very literal terms, what changed? What has changed in these last 16, 17, 20, I would say 15 years in India, 15, 16, 20 years in India, I would rather say, and probably 25, 30 years in US.
Yeah. True.
Something must have happened.
Definitely. Correct.
Something definitely must have happened. 30 years ago, something started happening in US, and around 20 years ago, something started happening in India. And with time, this something was increasing,
Right.
and along with it, autism was also.
Autism was increasing. Correct.
And that
True.
something must have the potential to affect the neurodevelopment of an embryo,
Right. So true.
right?
Yeah. Agreed.
Now, I can figure out only two things in my research so far.
Uh-huh.
One is mobile radiation.
Yeah.
There was no mobile phone 30 years ago. There was hardly any mobile
Yeah.
phone in India 20 years ago. The cell towers were not there.
Correct.
And I very distinctly remember that I used to live in a colony, and each house had lots of plants, trees, and the trees would be bursting with house sparrows.
Yeah.
A lot of house sparrows in each house. Vaya, जिसको हम कहते हैं. And as the mobile telephoning started, suddenly within a couple of years, all the sparrows disappeared.
Yeah.
Why it happened, it was later found out. It was later the research showed that the mobile tower radiation was somehow affecting the ability of the house sparrow eggs to hatch. The
Okay.
eggs were never hatching. Now, what is happening? Try to understand. The embryo of a bird is not very different from an embryo of a human being.
Oh my God. Yes.
So if that radiation can affect the embryo of a bird, affecting its development so that it never hatches, it never develops, why cannot it affect the human embryo?
Clearly. So true.
So that is a distinct possibility. And today we know that if you actually go to PubMed and look at the research data available for how mobile radiation affects different life forms, there is tons of research in vitro, in
Yeah.
vivo, plant research, microbial research, animal models. There's tons of data available.
Yeah.
And I have been charting the data from US because the US data is the most easily available. There is something that you can chart in terms of number of cell towers increasing per year. This data is from the telephone industry, mobile industry.
Okay.
It's not health industry. If you chart, there is a graph available for year on year number of mobile towers increasing in United States.
Correct.
And there is a chart available from CDA and from other health sites about the rise of autism per year.
Uh-huh.
You can literally put one on the other.
And then see the trend and compare.
It's absolutely same.
Wow.
It is absolutely same.
Oh my God. This is so interesting.
Yes. And another thing is, there are some another possible causes. There are a lot of organic compounds that are being used in agriculture today.
Hmm.
All the herbicides, pesticides, insecticides, glyphosate. And this I'm telling you because when we get some metabolic tests done, we do get autistic children with high glyphosate content.
Right.
So that is because all these organic compounds, they also have the potential to disturb lot of systems within the body.
Yeah, starting from genetic material itself.
Yes,
So.
absolutely. Today we know that it's very easy to affect the epigenetic part of the genetics.
Yeah.
All you need is a diet rich in CH3 molecules, and
Yeah.
you can change the epigenetics of a person. So, and there are a lot of other factors which can change the genetic expression of the person through epigenetics. So these chemicals might play a role. I'm not saying that they do play a role because there is a data available for the use of glycophosphates also. The
Okay.
chart is also available, but it's not like matching perfectly with the autism data.
Hmm. Acha.
It is both are rising, but they're not rising proportionately.
Hmm.
But when you see the data for mobile phone towers, it's absolutely proportional rise.
Yeah.
So
Yeah.
it's very fantastic, and if you understand what might be causing it, it becomes slightly easier to treat also.
True. True. Yeah. So I think, yeah, you're saying something, sir.
And we do know that mobile phones do make autistic children more autistic.
True. Absolutely.
Today, it's not about homeopathy. Every OT, every therapist, every pediatrician, every neuropediatrician will first thing they will tell you, remove the
Screen
phone,
time.
remove the screen time, remove the phone. And that's the general guideline given by any pediatrician, any neuropediatrician, any developmental pediatrician, any therapist. So why is that? Why an autistic child becomes more autistic if they use so much screen time, so much mobile phone?
Yeah.
It could be related only to the screen time, but I do feel that it's related to radiation also.
Radiation. So I think that is very important, sir, because till now even I used to give more importance to the screen time part, the lack of engagement with the environment and the way the screen and child communication happens, that might be affecting the skills to develop. But the radiation part is something also equally important, specifically when you talk about the. So I think that is super important to know and understand. So, yeah, thank you so much, sir, for this very important insight. Yeah, so going ahead, now let's just come to the side of actual practice when it comes to homeopathy and autism. So, many times in our clinic, we get patients who are two types of patients. Okay, one who are freshly diagnosed cases of autism, where the parent has got the diagnosis and somebody said ki homeopathy shuru karo, so they're directly coming to us. And then there could be patients who are like already started with some therapies, and then somebody said ki nahi, you should also try homeopathy, and then that's why they're coming to us. So in both the situations, what should be our approach in terms of starting homeopathy right away, or assessing them first via the battery of tests that we do otherwise if that has not been done properly, or and then should we tell them to approached and get the other therapy started as per the need of the child? How should be our approach?
All right. So what I do in my practice, I can tell you.
Yeah.
All right. For a very long time, for nearly 13, 10, 14 years, I used to actually do the diagnosis part also myself. I learned it.
Okay.
So even for most of my patients, I used to do ISAA rating. beta rating myself.
Okay.
So I would know quantitatively, I know where this child exists. Whether this is a mild autism, moderate autism, or severe autism. Today, with so much clinical experience, I actually don't need it because I can, within a couple of minutes, I can sense.
Yeah.
You have seen so many children, you know, you simply, it comes very naturally to you. You know, you see a child and within the first couple of minutes, you know where this child stands and what is the probable prognosis. But for majority of people, I would say that you should have a very fair idea of the diagnosis part.
Right.
You should
Okay.
understand whether the child is autistic or not. Because autism, again, is a spectrum disorder, and I say you will get children who will have mental retardation. Now, mental retardation is not autism. You will have
Yeah.
children who will have ADHD. ADHD is not autism. You will have children who will have developmental delay.
Yeah.
Developmental delay and speech delay is not autism. So,
Correct.
and there will be children who will have behavioral issues,
Yeah.
which also exist in several autistic children. But that if those behavioral issues exist in isolation, that is not autism.
Yeah.
So we need to understand that if you do not understand this diagnosis part, because each has a different kind of prognosis.
True.
Now, if you give a false prognosis to the parents, then it becomes very painful for them. A child with Down syndrome might have a very similar presentation in the first 2 years with an autistic child. But if you do not understand this is a Down syndrome child and you give the prognosis, no, I'll fix the child, then it becomes very difficult for the parent, for nobody else. For nobody else. So, and from homeopathic perspective also, if you do not understand the disease, you will not understand the common symptoms.
True.
If you do not understand the common symptoms, you will never be able to understand what is PQRS in this particular case. I'll give you an example. In repertory, you can find a rubric: walking, walks, toes only on.
Uh-huh.
This is
Oh,
a
okay.
rubric. The rubric exists in our repertory. All right. And there are a couple of remedies listed there. And one of the remedies, I believe, is zinc. Okay. Now, the rubric exists. The moment if you do not understand that this is a common symptom of autism, you are going to prescribe on its basis.
Yeah.
And
True.
this is where your failure begins.
True.
So that is why it is essential to understand what is PQRS in this case and what is common to this disease. And there
Yeah.
are a lot of symptoms related to autism which might be common to the disease, but they might seem strange to us because the homeopath has never come across those symptoms. So it will be
So
new for them. It will be strange for them. Oh, this child cannot walk on grass. This is something very strange. This child keeps sniffing everything. This is very strange. This child licks everything. This is very strange. But for autism, this is all common.
common. Correct.
So if you do not understand that this is common, these are common symptoms, you will end up prescribing on one of these and you will not hit the right remedy.
So true. Yeah. So that's very true, sir. And thank you for highlighting this point because I think there is some notion that is still prevalent in many of us that, I am a homeopath and I am going to treat the patient as a person and not the disease. So, under that aura or that thought process, many times we do not make that effort to get in depth of the diagnosis of the disease and understand the clinical part of the disease. So I think that is something very important that you mentioned just now.
Hahnemann has nowhere written that.
Yeah.
But if somebody is saying this, you can easily write it with a stamp paper that this person has never read organ. Never in his life he has read organ of medicine. If somebody is saying that you have to treat the whole, you have to treat the person, not the disease.
Yeah.
If you have to if somebody is telling you to ignore the disease, if somebody is telling you to treat the constitution,
Yeah.
that means they've never read all. They do not understand what Hahnemann has done, what Hahnemann has read. They are practicing only on hearsay. Because
Hmm.
if you read Organon of Medicine, in every place where he is mentioned to treat a case,
Hmm.
where he has asked you to individualize, he has asked you to specifically, and these are his words, treat the case of the disease.
Of the disease, right?
He has not said treat the person.
True.
Not even once. Not even once. And he has written treat the case of the disease probably 100 times.
Yeah. Yeah.
Why? Because without the disease, there is no case. Why is the patient coming to you? The patient is coming to you because he is suffering from a disease. The disease might be a nosological entity. But the end of the day, at the end of the day, that nosological entity is what bringing the patient to you. He is not asking you to prescribe only on the basis of that nosological entity. But what Hahnemann is asking you is to don't ignore the nosological entity, because that nosological entity gives you a fair idea of the kind of pathological changes, curability, the kind of posology that you need, and the kind of general management that would be required. And Hahnemann was very, very clear about it. And without that understanding of the common symptoms of the disease, you will never understand the uncommon symptoms of the disease, which are required to prescribe.
So true. Yeah. True. Very true, sir. So, yeah. So again, having said that, I was having one more question regarding, and again, the treatment part directly was that suppose if we start homeopathic treatment for a autistic child who is already on therapies, okay, or maybe he's about to start his therapy, say occupational therapy or speech therapy, whatever is indicated in that, and we are starting our homeopathic remedies simultaneously. Now, how do we identify that what is getting better by what? Because many times parents come and ask this question that, doctor, you're starting homeopathic pills, what will it improve? So how will we know that homeopathy is working, or what is going to improve after you start homeopathic pills? Whereas an occupational therapist can give you an answer that maybe after 4 months you can see a particular A skill developing or B skill developing. So how do we understand what is improving when we start homeopathy, and how do we differentiate that, whether it's our homeopathy or it's some other therapy that's working?
It is it is very difficult for, if you are starting two therapies simultaneously, there is no way to figure out what is happening with which
Yeah,
child. So what in my
right,
practice, what I tell the parents is that don't begin two therapies absolutely simultaneously.
right.
Give a gap of couple of months, you will know what is doing.
Hmm. Yeah,
If somebody is coming to me with occupational therapy, who has done occupational therapy, he knows what has occupational therapy done or is able to do. So it's not difficult for them to understand what homeopathy will add. Because they've
hmm.
already experienced OT for 6 months or 3 months. And then they come to me, and then the moment homeopathy begins and they see a very big improvement in the child's ability, then they know that it's not only because of OT.
Hmm.
Similarly, if they begin my treatment and they want to start OT, I say, give me a couple of months.
Okay, yeah.
Then start OT, so that then you will have a very fair idea, and even I'll have some idea how the child is responding.
Hmm. Right.
So this is, and then with such a long experience, after seeing so many children, I also have learned what OT can do and what OT cannot do.
Yeah.
So that kind of skill development comes after experience. Also, even if two therapies are working simultaneously, I know what is the role of OT or ABA and what is my role.
Yeah.
What will not improve with OT, I know.
Correct.
But for
Correct.
that, you need a lot of clinical experience.
Yeah.
For a beginner, I would say don't start two therapies simultaneously. But at the same time, I would say the treatment of an autistic child should begin as soon as possible. The earlier, the better. It has a huge difference on the prognosis. a 3-year old child with a ESA rating of 120 and a 6-year child old child of ESA rating of 120, they have a very different prognosis. Very different
True.
prognosis. So the earlier you bring a child for treatment, the better is the prognosis, and the therapy should also not be denied to the child indefinitely. I'll never deny the child therapies for 6 months, 8 months, 10 months, simply because I'm trying to see what my medicine is doing.
Hmm.
Because we have got a
Correct.
very narrow window of a couple of years in which we have to do the maximum, get the maximum out of the treatment.
Yeah.
It's not asthma which I can treat for 20 years. If
Correct.
need be. It's
Correct.
a neurodevelopmental disorder, and we know that the neurodevelopment there is a peak window between 2 years to 7 years.
True.
I missed that window, and then I have got a lot of deficits that I have to deal with.
So
So if
true.
I know that occupational therapy can help this child, or ABA can help this child, or speech therapy can help this child, I'll never deny that. Maybe a couple of months, but not more than that.
Yeah. Correct. Correct. Yeah. So yeah, this is very important, sir. Thank you for highlighting, because I think this time, the race with time that we have is very crucial for the fact that the brain is most at its peak of its neuroplasticity when it comes to the age of 2 to 7 years. After that, not that the brain doesn't change, but the change is very slow. So if you want to rewire your brain, the whole process is going to take a lot of time.
Today I get children who are 12 years, 13-year-old, and now I am treating them, starting treatment at 12 years, 13 years
Starting.
old. They might be in a range where the ESA is probably just 100.
Yeah.
But even then, I can't give them a very good prognosis.
True.
Because
True.
I know there is a golden period of that development has gone, and we have to have very conservative prognosis in those cases.
So
Not
true.
that they
So
will not
true.
improve, but the quantum of improvement would be very, very different. If somebody brings me a child of 100 ESA, I'll probably say, okay, most likely you'll get cured. Now, cure
Yeah.
is a very radical term, but I'll still use it because I see that happening.
Yeah. True.
I see a lot of children who become absolutely neuro-normal, who are going to normal schools, who are going to, some of them are now in higher education, one of them is also doing engineering. So I see a lot of children becoming neuro-normal. So I
Yeah.
won't say that they cannot be cured, but we have to use that word with lot of restraint.
Correct.
When a patient comes to me and asks me, "Sir, can you cure it?" I say, "I do not know."
Yeah.
I never straightforwardly tell them that, okay, I can cure. Simply because I have cured so and so case, I'll cure your case also. Uh, that I never do. Because I know, because I don't know which case will respond how.
So true.
We follow the same protocol, same principles. There is the same way in which we treat, but one child will respond like this, and another will take tons of time. They will simply not respond, and we have no idea. Sometimes we have no idea why this child is not responding.
Correct.
So
Correct.
we do end up with those blocks in a lot of cases. So there is no way to identify which case is going to get cured, which case is not going to get cured, and which case is going to improve 20%, and which case is going to get improve 80%. So what I do in my practice is that when an autistic child comes to my clinic, I first make an assessment. Where is the child lying? And mild autism, moderate autism, or severe autism? And then I look at the age of the child and what other. There are a lot of other factors where to assess the severity, not just on the ESI score, but the kind of hang you get with experience also. But in general, if the child is in mild autism with the CARS score of less than 30 or ESI score of under 106, then I would say that most have very good prognosis.
Yeah.
Most
That's
have very good prognosis with homeopathy. A combination of homeopathy and OT, and sometimes speech therapy is required in these cases. Sometimes it's not required, but these two therapies alone will bring most of the children out of the spectrum.
Yeah.
Now there are two issues, two things. I'll come back to this later, but let's talk about the prognosis part first. So if the child is mild autism, excellent prognosis. Moderate autism, I say that moderate autism can improve anywhere between 20% to 100%. Where that child will settle, I cannot say, because in moderate autism, the range is huge.
Yeah.
Any child with ESA score 107 to 153, they are all moderate. Technically,
True.
they are all moderate. But the
Technically
child
moderate.
with an ESA score of 110 and another child with an ESA score of 150, there is a world of difference in them.
Qualitatively, they are very different.
Very, very different. And their prognosis is also different. So I give them a very broad prognosis. The improvement can happen even 20%, or it can happen 80, 90, 100% also. I cannot foretell that.
Yeah.
Sometimes a child with ESA score 150 comes at a young age and they respond beautifully. They become, they go into mild autism, and they sometimes become normal also.
Yeah.
And then there is severe autism, where the child is often complicated with mental retardation or epilepsy or total
ADHD or various things.
ADHD or total absence of speech. So these cases have a relatively poor prognosis. We can improve them. We can improve them in bits and pieces, like some of the most troubling symptoms, especially related to behavior, they can be improved. If the child is having uncontrolled seizures, that can be improved. Hyperactivity can be reduced to a certain extent, but it's very difficult for us to bring the child towards even mild autism. They might, from severe autism, they might end up being moderate autism, but it's very difficult to even make them mild autism.
Yeah.
And so another thing that I was telling you was about about this child coming out of the spectrum. I said most of the children who are mildly autistic, they easily come out of the spectrum. Now, coming out of the spectrum doesn't mean becoming neuronormal. There is a difference. There is a difference.
Yeah.
Coming out of the spectrum means that the child has ESA rating of less than 70.
Yeah.
But that doesn't mean that the child is perfectly at par with the peers.
Other child. Correct. Agreed.
So we have to even tell them this. So when
Yeah.
the parents ask me, when will my child become normal like other children? I tell them, I don't know. My first priority is that this child should become non-autistic first, should come out of the spectrum first, and then whatever residual deficits are remaining, we can work on them through homeopathy, through different kind of special education, through therapies, through training. And even after that, there might be some deficit areas that will remain.
Yeah.
In certain cases, the deficit areas remain. If a child is not good in maths, the child might never become good in maths. I cannot develop that ability to do complicated calculations.
Yeah.
The child will learn to do simple addition, subtraction, that's fine. But if you want them to learn algebra and arithmetic of a high school, then probably they will not learn that.
True.
And when I'm treating an autistic child, probably that is my concern also. My first concern is that the child should develop normal eye contact. The child should develop normal speech. The child should be able to tell about his needs. The child should be able to follow the commands. The child should be able to relate emotionally to the parents. The child should be able to understand social relationships. That is my first concern. My first concern is not कि वो 12 करेगा या नहीं करेगा. So I say let me handle this part first, then we'll address as the case progresses, we'll come there also.
Correct.
But to what extent we'll go there, I cannot foretell that. Nobody can foretell.
Correct. Very true, sir. And what few important things that your entire this answer brought up was that we have to many times not just see homeopathy as a standalone therapy, but we have to many times integrate it with other therapies as per the need of child. Some may need speech therapy, some may need social skills, depending on individual needs of child. And then in that scenario, it is important to for us as homeopaths to also know what other therapies are meant for, why OT is going for that child, why speech therapy is going for that child. And that is why wherever possible, I also feel as a professional and as a parent of an autistic child that it is important that we keep in connect with the other team who is handling all these aspects rather than being disconnected कि उनका therapy चल रहा है हम हमारा देखेंगे, you know, we cannot function that way.
Today, most of the referrals that I get are from other therapists.
Exactly.
We have
True.
seen my patients improving significantly. Now, these therapists, they get 2 buckets of children, one who are taking homeopathy from me and others who are not taking homeopathy from me. And these therapists see stark difference in these 2 buckets. Correct. And then they refer the rest of the bucket to me. Yeah. So most of the people is coming that way today.
Correct. And I think you showing those results must be generating confidence in those therapists enough that they come to you and they also try to amalgamate their approach with you, discuss with you what they are doing, how they are doing, and that will lead to a beautiful integration of the best of all the worlds for the child, which is essential eventually.
You understand it in terms of what I tell my patients, कि दवाई खाने से ज्ञान नहीं आता.
Yeah.
Medicine can increase your ability to learn, but it cannot teach you. It cannot teach you. So if a child on whom I'm working with medicines, if the parents or the therapist are not teaching the child, the neural development will not amount to anything.
Yeah.
The medicine will not teach you this is blue, this is yellow, this is red, this is green. The medicine will not teach you 2 into 2 is 4.
Yeah. That is a part of school.
Somebody has to teach.
Yeah.
And this teaching part, because the child is a special child, you need special educators.
True.
You need therapists. You cannot deny that.
Yeah.
So it's very, very imperative. It's important that we work with these therapists as a team. We understand what they are doing, what are their strengths, what are their limitations. For example, if a child is coming to me for, say, just yesterday, a child came to me and the mother said, he always does this.
Okay.
Always putting the lips inside the mouth. And I just told them, look, or clenching the teeth or grinding the teeth. I just tell them, okay, this is a sensitive issue. You need the therapist to do some massage. Oral massage is required to reduce these.
The oral sensitivity and
oral sensitivity needs to be reduced, and the massage, we know that oral massage helps. So why would I deny something that I know works? But at the same time, I must know what works and what doesn't work. So it's very important that you understand for any doctor. Homeopaths cannot work without the understanding of full medical systems.
Again, yeah.
Homeopathy is a medical science, and all complementary approaches, be it general medicine or be it any other alternative therapy or any complementary therapy, the homeopath must be, even if not well versed, they must be aware of them.
Correct. True. So true, sir. So you were just mentioning a lot right now about we have to spend as a homeopath time with the family wherein we make them understand this whole process, because people come to us with this idea, they see homeopathy as a magic more than science many times. So they come with this idea कि हाँ बस अभी आपके पास आए homeopathy से ठीक करा दो उसको. So that patient education or that parent education about what we are doing and how we are doing, I think the sentence that you just said, that medicine खा के ज्ञान नहीं आएगा, that is so important for us to convey. So here I feel that do we as homeopaths stand at a better position to not just see the child as a whole, because an autistic child comes along with his family. The whole family is impacted in multiple ways. So should we, or rather are we in a better position to see the whole family as a unit and treat them? Because many times I've seen that parents need healing when a child is diagnosed with autism. Parents need psychoeducation. Parents need lot of understanding and support, which at least in India, I haven't seen them getting that much. And they are never going to visit a psychiatrist or a psychotherapist कि मेरा बच्चा autistic है, मुझे ठीक करो, या मेरे को संभालो. That is not the kind of thing that we do. So, what are your thoughts on this, sir?
Look, again, I will say that even Hahnemann in aphorism number 228. I'm sorry, I bring him back. So,
No, sir, please bring Hahnemann again and again.
For us to rewrite or to revisit that. I find whatever we speak, he has said something about it. So in aphorism number 228, in these mental health aphorisms, he did write about auxiliary treatment also. Yeah. And in that he wrote about counseling, about talking to the patient. He did not specifically write about the family, but yes, the family is included because he did mention attendance.
Yeah, true.
What I do feel is that not just homeopaths, any doctor should have a lot of empathy for the parents of an autistic child, because treating an autistic or rearing an autistic child is a challenge, big challenge. Yeah. And the world gets upside down of a parent the moment they realize that the child is autistic. And with the kind of grim prognosis that the general medicine gives them. Yeah. There is no medicine. There is no medicine except for except for reducing hyperactivity. There is absolutely no medicine for autism in conventional medicine. True. They simply ask you to take therapies, and the therapist would never tell you that they can cure. So they are left with a child which cannot be cured, and they don't see any hope. And in that case, if a homeopath comes in and say, okay, there is some chance that the child can get cured. A mild case can get cured, a moderate case can get very good results. So one thing is, I believe that the parents need to be educated. They need to be told what autism is and what kind of prognosis homeopathy has to offer. The doctor needs to have a lot of empathy, not just for the child, but for the parents also, because they are suffering. They need proper guidance. So I sometimes sit with them just to guide them about OT, ABA, sensory integration therapy. We talk about speech therapy. We talk about speech therapy, when the speech therapy is required, when it is not required. We'll talk about this GFCF diet. We'll talk about camel milk. We'll talk about oxygen therapy. We'll talk about what do you call them?
Backflower?
No, not backflower. It's just skipping my tongue. The cells that you take from the umbilicus of a newborn.
Stem cell therapy.
Stem cells. So stem cell therapy. I discuss all of it with my parents, even if it's not my sphere. Even if it's not my sphere, I'll speak with them, I'll guide them, because as a doctor, I definitely know more about stem cell therapy and its role, or the effect of GFCF diet, or the camel milk, than a parent.
Yeah.
So I don't mind guiding them, giving them the advice, or sharing my clinical experience, even if it takes my time. Because I understand that the parents have no other source of information except Google Baba.
Yeah, true. Dr. Google.
So that Dr. Google is often very confusing. Because when you go to Google, and everybody should be on GFCF diet. But that's not necessary. In practically, when I treat autistic children, majority of children do not need GFCF diet. Only some need. And we can identify those children. Majority of time, we can identify those children.
Yeah, that's true. And very important thing that you mentioned about being empathetic with the parents, not just with the child, is important, because parents in desperation will try anything and everything. They will start homeopathy, stop homeopathy in between, start something else. So, And who is not desperate if their child is going to suffer? Every parent is going to get desperate. That's why I heard somewhere this beautiful line to preserve our empathy when we are treating such parents and the child is that never judge the parents, just judge the treatments. Just check for the evidences, just gather information so that you can guide the parents in a correct way rather than judging the parents for starting or stopping any treatment in between or whatever they do. So that was something very enlightening for us, that we cannot be just in that role where we take a follow-up, give remedy to the patient, and then that's it. We have to address all these issues if we want to
You are
maintain.
the guide also.
Exactly.
You are the
True.
guide also, but you have to earn that.
Yeah.
You cannot be guide with half-baked knowledge yourself.
Yeah. True. That's why aphorism 3, knowledge of diseases, rather knowledge of physician.
Yes.
All these knowledges we need to
All
have.
these knowledges, absolutely. All of it.
True.
What he has written in aphorism 3 and aphorism 5. Not 3, it's aphorism 5. So, all even the obstacles to health, all the family situations, hereditary, past medical illnesses, everything needs to be taken into consideration.
Yeah. True. Yeah. So just we had a question which is probably somewhere connected to this, that do we need to take I think mother's history when we are treating an autistic child?
Yes, we do.
Yeah. I'm
We
just
do
checking
need
if
to know
I,
mother's
yeah.
history. Mother's history is important. Why mother's history is important? Because any congenital problem, not just
Huh.
autism, for any congenital problem, mother's history is vital.
Yeah. Correct.
Mother's history is vital because something could have happened during pregnancy. And if you actually do cease therapy, now cease therapy is
Mm-hmm.
the form of isotherapy or a form of homeopathy which was started by Dennis Smith for autistic
Mm.
children. If you actually do cease therapy, uh, Dennis Smiths believe that most of these autistic children cases occur because something happened to the mother. Some of the medicines mother might have taken, some vaccines mother might have taken. So in cease therapy, a lot of the trauma the mother that goes through, or the lot of medicines that the mother has taken, they are sequentially antidoted with a set of different homeopathic medicines
Mm.
to treat autism. Now, I
Mm.
personally don't use that method. I understand that method. I use that method, but I don't use it blindly in every case. I know where it's needed and where it's not needed. But yes, mother's history is important, very important, and more so because an autistic child by itself is not going to give you any good symptoms in
Yeah.
most cases.
True.
So you need a lot of lateral information.
Correct.
And sometimes it's very difficult to even get the herring's 3-leg stool.
Yeah.
It's simply not possible. There are so many cases where I end up prescribing only on one PQRS.
Yeah.
Because despite all the case history, you don't get anything except for the common symptoms. Now, so taking an autistic case is itself an art.
Yeah.
It's,
Okay.
it's,
True.
it's not like you can approach the case just like that. Just like any other case, any other pediatric case, no.
Mm.
Because any other pediatric case will give you a lot of symptoms. An autistic child will not give you any symptom.
Yeah. Whatever is there, those are all common symptoms of
All
autism.
common symptoms. Now, it is like finding a needle in a haystack. Finding a PQRS is like finding a needle in a haystack in those cases. And for that, you need all the lateral information, all the physical generals. The thirst is required, the appetite is required, food desires and aversions, color preferences, habits, behavioral patterns, which could be accentuated in a certain way,
Mm.
preferences, fears, mother's history, all the medicines that the mother or the child has taken, vaccination, grandparents' medical history. You don't know where you are going to hit the remedy.
Yeah.
But it's not as straightforward as any other case. It's
Yeah.
something that even I needed to learn with experience. Because the moment you say, okay, tell me the symptoms, the child will not tell you the symptoms. The parents will usually give you a file. So
Yeah.
my child has been diagnosed with autism. We took him to the doctor because he was not speaking till 3 years or 3.5 years age. And now the doctor says he has autism.
Okay.
This is the kind of diagnosis and set of complaints that parents are bringing the child to us. So it needs a lot of digging. It needs a lot of digging to find the right solution.
Yeah. Right. So I was just wondering, sir, that in some situations where we don't have parents who have even a basic understanding, or for whatever reason they're not able to share a lot of lateral information also with us, and we have common symptoms. So in those cases, how do we go ahead? Like, there is one question that has been asked, that are there any remedies typically coming, frequently indicated remedies in autism? So is it like, can we have some basic common remedies that come up where we don't have a lot of data to individualize the
I
case?
will not recommend a therapeutic approach in homeopathy.
Okay.
Okay.
Yeah.
There are certain group of remedies that come up very often,
Mm-hmm.
but again, that is not one remedy or
Yeah.
two remedies or five remedies. It must be at least 20 remedies. Now, out of those 20 remedies, which you can give, I don't know. You
Correct.
still need to figure out something.
Mm.
You still need to figure out something.
So hunt has to go on for at least
Some
one PQRS.
hand has to be made.
Hmm.
There
Yeah.
is no other way. There is no other way. How do you prescribe Helleborus without any
True.
symptom?
True.
You know how I prescribe Helleborus in autistic children?
Mm-hmm.
Helleborus has a symptom lack of sensitivity to pain.
Yeah. Oh. Okay.
Now, if I don't find anything in a case and I find a case where there is the child has absolutely no response, even if he gets a burn or a crush injury, the child will not tell you anything about it. The child will not show any emotional expression. Then sometimes this is all the information that I have. And then I'll say, okay, this is possibly the best remedy that I can think of this time. I don't know this will be similar or not.
Correct. Correct.
So there are
Yeah.
cases in which you hit the stimulum right in the first consultation, but there are a lot of cases where you keep on like zigzag, 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 because as symptom pictures, whatever symptoms are coming up, you prescribe on that basis, and then in a couple of months, some new symptoms come up, or you get a better insight into that case, or you retake the case, or the parents mention something that they forgot to mention earlier, and then you narrow down your choice to a better prescription.
Yeah. Correct. Okay. Got it, sir. Yeah. So clearly, then in that case, as we're seeing how the autism is and how our journey as homeopaths towards making the child more and more neuro-normal, I think this is quite a thing that is going to go for a long term, right? So in your experience, sir, what do you feel that how long a child will require treatment, or how long the homeopathic treatment can help the child?
How long the treatment would be required, that again depends upon at what the age the child comes and what specific deficits the child has. Where on the scale the child lies, mild, moderate, severe. Most children need treatment for at least a couple of years.
Okay.
At least a couple of years. So there are children who sometimes become neuronormal within months,
Hmm.
but they are exception, they are not the norm.
Hmm.
For majority, the treatment duration could be anywhere between 2 to 5 years.
Hmm. Yeah.
But at the same time, I must say that the effect of the treatment is usually visible very quickly.
Hmm.
It's
Okay.
not that you have to wait for 6 months to see certain changes.
Okay.
Most of my patients will respond positive changes within the first 2 months.
Okay. Wow.
They know something is working. I know something is working. We are on the
Yeah.
right track. It doesn't take more than a month or two to figure out whether your patient has responded to the treatment or not responded to it.
Hmm. Yeah. Okay, that is very interesting, sir, because normally when we go to other therapies, say occupational therapy or speech therapy, we're always told by those therapists that you will have to wait for at least 4 or 5 months to see some tangible change in the child in terms of developing a particular skill. But when it comes to homeopathy, that is, I think, makes homeopathy a very distinctive and very interesting thing that you can actually see the results so quickly. Right now,
Absolutely. If your remedy selection is good, changes occur beautifully fast.
yeah,
Beautifully.
right. True,
We can
true.
easily see a 20-point difference in ESI score within 2 months.
Oh, wow. That's awesome.
Yes, that kind of transformation is possible. Within 2, 3 months, you can see a significant decrease in the ESI score.
Yeah, right. Yeah, so then in that case, so now I'm even wondering that when we start treating a case of autism with homeopathy, rather than just having a regular follow-up criteria to be more objective to measure the outcome or the measure the change in the child, would it be more advisable to use these scales, ESA or MCHAD, whatever is suitable, for even assessing the child at least once in 2, 3 months?
I would say that we should,
Hmm. That would add more
especially
objectivity.
especially if you are MD Pediatrics in homeopathy or MD Psychiatry in homeopathy, and
Good.
if you are specializing in it, if there is a large bulk of parents, patients who are coming to you, because if you document your cases properly, then it adds a lot of value to the science also.
Yeah, true,
Because otherwise, any cure that you make is hearsay.
true. We need more and more objectivity to it.
Definitely, there is no denying that. And if there are scales available and that you can use, I will again reiterate that you cannot treat on the basis of those scales. They are
Yeah,
only meant for diagnosis and prognostic evaluation. At
correct.
the end of the day, you need to learn homeopathy well, you need to learn to individualize, and there is no shortcut to that. There is no therapeutic approach to autism.
Yes, yes.
There is an approach to autism. There is a certain of set of remedies which are going to be more indicated in autistic children, but there is no therapeutic approach that if you get left-sided headache, take this. If you get right-sided headache, take this. If you get sinusitis, take Calibicom. If you get uh, right-sided sore throat, take Merck iode
Hmm.
and Merck iode flavors. If it's left-sided, take Merck iode rubrum. That kind of approach doesn't work in autism.
Totally. So, principle of individualization
And I
and
would add
holistic
again, I
approach.
would add again here that Baraita carb doesn't work in majority of autistic children.
I second your opinion. So true.
Because
Yeah.
I do know somehow any child who is slightly mentally delayed, I don't even use the word retarded because
Yeah.
it has negative connotations. So any kind of developmental delay and homeopath blindly give Baraita carb
Baraita.
because that is the only remedy they know.
Yeah.
And that is actually sorry because ultimately, if you individualize, there are a lot of medicines which have that kind of retardation where there's dwarfishness, mental dwarfishness, or developmental
Hmm.
delay. And there are tons of rubrics that you can choose from.
Uh-huh.
There are at least good 50 remedies that can create a bouquet that will fit majority of cases of autism.
True. Very true.
But at the end of the day, you need to individualize from those 50 remedies. Now, if you
Yeah.
want to say, no, I don't have that kind of time and effort, I don't want to put in that kind of effort, but I want to treat autism, then you are just being a fraud.
Basically, we can't be so frivolous
No,
about
no,
such condition.
absolutely. It's a matter of life and death.
True.
And it's not about autism, it's for any disease.
Any condition. True.
I treat all, it's not that I'm just treating pediatric patients. I'm treating all kind of patients. I treat asthma also, I treat migraine also, I treat spondylitis also, I treat lichen planus also, all sorts of diseases. I treat depression and
Hmm.
mania also. But for any disease, any disease, you cannot be frivolous.
Yeah.
Because there is a patient, there is a person who is suffering, and you simply cannot play doctor with them.
Yeah. True.
You need to master your art. You need to be the
True.
best in your trade,
True.
so that you can be honestly, you can be the best option that this patient has.
Yeah.
And if that
True.
kind of commitment and zeal every homeopath develops, I don't see any limitation for homeopathy. The
Agreed.
problem, only problem in homeopathy is that homeopaths are not well trained enough, and they are not well passionate enough about homeopathy.
Yeah.
If they are trained well and they understand the scope that homeopathy has, and they develop the kind of passion that is required to be a good homeopath, then sky is the limit. There is
Yeah.
nothing that you cannot work on. I won't say cure, but I see tons of incurable, so-called incurable cases, and or very difficult cases, difficult syndromes. I get cases where there are uh, genetic anomalies, where there are congenital anomalies, geriatric cases which are difficult to treat. Rarest of the rare syndromes I get to treat, and I know many of them I cannot cure.
Mm.
I'm sorry about that, Diwali
No
time.
problem. Yeah. Yeah.
So,
So true.
but there is no harm in trying, because even if you can improve the quality of life of such a patient by 10, 15, 20%, that makes a lot of difference to
Big
those
difference.
patients.
Yeah.
So this is what I would say are my 2 cents.
Yeah, no, that is so important. And the passion that you mentioned about that we need to have as homeopaths, and the zeal to keep learning, not just after BHMS and MD, but throughout probably is important. And plus not being frivolous, because I think when I, as a parent, when I wanted to start therapy for my own son, the one drawback that I noticed was that when I'm opening researches to check out, what are the conventional therapies, how much is the evidence established for each therapy, I realized somewhere, I might be wrong, so please give your inputs on that, that when it came to proper research, in terms of proper evidence-based research, in homeopathy, and when I compared it with other conventional therapies like again speech and OT, etc., I realized that the research was qualitatively not good enough for me as a parent to even say that, okay, if I start homeopathy, yes, this is what it will do. As a homeopath, I knew what it can do. But when I put myself in that zone of parent or some other professional, I don't see that quality of research yet, as compared to the other systems that we have. So if we want to improve our evidence base, because anecdotal things are a lot of there with homeopathy, but then hardcore clinical trials or mediation analysis where we test the effect of homeopathy when added to the regular therapies, that is something relatively lesser, is what I felt. Your input, sir, on that?
I do totally agree to that. We do need a lot of more quantitative data. We need more research. The only problem that I see with that kind of research is that often that research is very, what I would say, allopathicized.
Yeah, true.
That for example, the research would be the role of Calibicrom in sinusitis.
Yeah,
Now, this is an allopathic mind. Or
exactly.
we'll get a study on uh, the role of any remedy, natrum phos, in reducing hyperacidity. Now, we don't need that kind of research in allopathy. We have
True.
allopathy for that. If you want to become a bad version of allopathy, then you can follow that kind of research.
Yeah,
But when you are trying to be an alternative to allopathy, you cannot end up doing that kind of research alone. That
true.
kind of research might be good for pharmaceutical companies who want to sell complexes,
Hmm.
but for a homeopath who wants to individualize his cases, that kind of research doesn't amount to
Yeah.
anything. What we do need is clinical verification and scientific verification that, okay, the system works and the medicines work. And this is the approach that we need to follow. In that kind of research, okay, you take 20 cases of autism, which are purely based on occupational therapy and speech
Yeah.
therapy. And in the other 20 cases, we add homeopathy.
Right.
We measure all these children with ESA score or CAR score at the beginning and then evaluate every 3 months for a year. And then
Yeah.
we are able to see what happened to these children who were given homeopathy and what happened to these children who were not given homeopathy.
Not correct.
The choice of the remedy is immaterial.
Correct. It has to be individualized remedy that has to be
Ultimately, it has
given.
to be individualized. I can tell you there is a fair group, common group of remedies that will come up. I won't deny that.
Yeah.
Because somebody has asked this, I'm telling. Somebody
Yeah.
posted this question. Uh, do you know that one of the very common remedies that I see in autistic children is melatonin?
Oh, okay.
You would never think of
We
it.
can't imagine of belladonna just like that. Yeah.
Why? Because we have been taught that belladonna is an acute
With
remedy
inflammation.
for inflammation. But if you actually go and repertorize, you will end up getting belladonna
Okay. True.
in a lot of autistic children. But then you should have the understanding of individualization to actually prescribe belladonna for an autistic children and see the results.
Correct.
So belladonna is a very common remedy. Then carcinosin is another common remedy. Tuberculinum is very commonly used. Cupromet is a common remedy. Carcinosin has different versions that can be used.
Wow.
Then natrum group is very commonly indicated. Calcarea group is very commonly indicated. Baryta, very rarely, in some cases only. And sulfur is very, very useful in autistic children. I
Yeah.
see a lot of cases where sulfur is done well. Medorinum is very good. Tarantula hispanica is very, very useful in a lot of cases where there's a lot of aggression and violence. Uh, so a lot of remedies. We can figure out probably another 10, 15 commonly remedies, as I said, hellivorous. But then there are remedies, there are a lot of cases which go out of that spectrum.
Correct.
I'll tell you, I treated one case of autism where the remedy prescribed was lycopodium.
Okay.
Lycopodium is also very commonly indicated. That reminds me. But lycopodium, and the only symptom in that case was that this child had unending craving for tomatoes.
Oh,
Lycopodium is tomato.
correct.
And if you look at the repertory craving for tomatoes, there's only one remedy like this.
Yeah.
And I could not figure any other symptom in that case. And the child would go to the fridge all day and just eat tomato, eat tomato, eat tomato. And the child improved with lycopodium.
Wonderful.
So you have to remain open. There is one case which improved with a remedy, Indian remedy called kurchi,
Ah,
which is
okay.
used for diarrhea,
Yeah.
which is used for gastroenteritis. But then you have to be open to that kind of PQRS. Yeah, this patient is giving me symptoms of this remedy. Let me forget everything that I've learned before. Let me see where this child is taking me. Where this child is taking me. That kind of openness is very important. A lot of patients will fit in those 20, 30, 40, 50 remedies, but there will be cases outside of those
Out of that.
30, 40, 50 remedies. And if you become prejudiced towards those 20, 30 remedies, you will never get to cure those cases, which are
Yeah.
outside that.
So true. So true. Wow, and that brings us even to the fact that how every single aphorism that Hanam has mentioned can be put to practice when we are treating autism too, not just any other illness. Being unprejudiced approach to knowledge of physician to everything that Hanam
Absolutely.
has absolutely put in our books. So yeah, wow. Wow, this was so interesting, sir. I mean, lot of insights I got from this particular session. I can just see one more question. I'll just read it out. Asked by holistichomeopathy.co. Can parent stress affect the child to be hyperactive or have low attention span? I think the clear answer is yes, of course, which kind of stress
Absolutely.
we are looking for. But
Absolutely. It can have
yeah,
an effect. It can have a bearing. even otherwise also, a mother's state during pregnancy has a lot of effect on the child's mental state.
True.
For example, when I'm taking a pediatric case or a neonate case, I often ask about the cravings of the mother during pregnancy.
Okay.
What is it that you used to enjoy during pregnancy? If I'm
Yeah.
getting a child who is like 3 months old, what I cannot expect any subjective symptoms there.
Yeah.
And I get 3-month-old child, 6-month-old child. Sometimes I get childs who are a few days old. So then I need to take the mother's history. Mother ne kya khaya? What did you eat yesterday? If the mother is
Yeah.
breastfeeding, I'll take the mother's diet into consideration.
True.
I'll take mother's emotions. Were you angry? We have remedies now.
Yeah.
We have rubrics. Convulsions in children after anger in mother. You have this rubric.
Correct. Correct.
So
Yeah.
why would a child get convulsion if the mother gets angry?
Yeah.
Because the mother's mental state is affecting the child through the milk.
Right. Very true.
So definitely mother's state is very, very vital to understand. There are no two doubts about it.
Yeah. Very true. That's true. Sir, I think we have been discussing it for a while, but I have a few good amount of questions. Can we take that up quickly from our audiences? Okay. So going ahead, 1 second. My scrolling is sort of stuck. 1 minute. Yeah, I can see a question asked by Rajat sir over here. Your thoughts on GNM therapy and predictive homeopathy?
Okay. Look, GNM is not a therapy per se. GNM is a theory which is being used by certain homeopaths. Per se, it has nothing to do with homeopathy. It has been superimposed over homeopathy. And I won't go into its merit. It's for you to decide because I don't practice it. Predictive homeopathy, again, there is no... If you follow Hahnemann, all systems, subsystems, be it predictive homeopathy or sensation method or Segal's method, the basics do not change.
Correct.
The basics of treatment do not change. You might interpret the symptoms slightly different, or you might give more value to a certain set of symptoms, but the overall approach to the case doesn't change.
Yeah. I think even the goal doesn't change. That arriving at the simillimum.
हो क्या रहा है इसमें कि कोई हाथी है, कोई पूंछ पकड़ के डायग्नोस कर रहा है हाथी को, कोई सूंड पकड़ के डायग्नोस कर रहा है हाथी को, कोई पैर पकड़ के, कोई कान पकड़ के, बट हाथी तो पूरा ही है.
हाथी है वो समझ में आ गया. That is all that matters.
Whether you figure out if you are able to see the whole elephant, there is nothing more beautiful than that.
Correct.
But if you are specifically trained to diagnose the elephant by touching its tail, then okay. If you are comfortable doing that with every case, then I'm okay with that. If you are okay with that,
true.
If you just want to touch the trunk or the ears of the elephant to diagnose, and you say no, I'll not touch anything else, even if I diagnose wrong.
Yeah.
Even if my treatment is wrong, then okay, so be it. That's your personal choice. I still feel that you should have the understanding of homeopathy as a science, as a holistic science, as a science which gives equal value to physical as well as mental symptoms, and which you need to master as a whole.
Yeah.
I'm not against any approach. I must say, I've learned, Dr. Sankran is a good friend. I've learned a lot from Dr. Vijayakar also. I've learned a lot from Dr. Sehgal also, from the SHF approach also. So there's no denying the utility of those approaches or what they can add. But what I feel is that they add one more arrow to my armor. Correct. They are not the sole arrow.
Yeah.
in certain cases, I'll probably gain something from the sensation method. In certain cases, I gain something from the HHF method. In certain cases, predictive homeopathy might give me certain insights about the way they do generalize or the way they use thermals or the
True.
GNN theory, which has certain correlations with the kind of stress
Hmm.
to which they relate different diseases. Okay, your mother had this stress, so she developed this disease, and your father had this stress, so they developed this disease. And because of this kind of stress, this particular part will get affected. These are theories which I'm not saying are totally right or totally wrong. There might be something good in each of them. It's for you to pick what you need to take from them. But at the end of the day, I say that you need to learn to see the whole element.
Correct. Yeah. Correct. And again, I think even here also not be too prejudiced about just one approach or just one method, being open to using whatever is in my armor and just reach the simillimum. Eventually, that's what matters.
Absolutely. These are all tools to refine the simillimum. So
Correct.
whatever tool helps you be more precise, that's good enough.
Use that. True. Perfect. Yeah. So there is one more question related to again the remedy or the approach is that, so sir, constitutional treatment for mother is okay or any other approach again connected with mother, I guess.
Again, homeopathy doesn't treat constitution.
Exactly. We just discussed that.
Why would you treat a mother who has no problem?
Yeah.
Why on earth? You can give sulfur to remove the underlying sora, but that is hypothetical.
Yeah. Yeah.
You don't know what sora is. You don't know in what form the sora is. So you are treating something that you cannot see, you cannot measure, you cannot visualize, and the cause of which you do not know, the effect of which you do not know, but you want to treat it with sulfur.
Yeah.
And then you will quote, because it's written in certain literature, in certain homeopathic literature, that if you give sulfur 200 or sulfur 1 to the mother,
Mother
the
also.
child would be healthier.
Yeah.
I
Yeah.
believe Ken wrote this.
Hmm.
So, but again, this is hypothetical. We need studies for that.
True.
ठीक है, मान लिया आप जो कहते हो, but then have the courage to conduct a study, give 20 or 50 females sulfur during pregnancy, and do not give 50 pregnant females, any medicine during pregnancy, and see what happens to them and to their children. Have that kind of study. Then we can say, not because certain author has written, because that author wrote without any scientific data. And whatever data that author wrote in, he did not share that data with us. He might have written that just out after seeing some changes in 2 cases. But for those two cases, you can not generalize.
Correct.
We don't know on what data those assertions have been written. So if you want to follow those assertions, have the courage to actually retest those assertions.
True. Yeah, I think, and if any MD students are over here, I think you have got so many research topics from what sir has been just discussing today. There are so many things that we have to find answers to via conducting all these trials, right? So, sir, I think you have answered this question, but still there is a question related to case taking maybe. So, Yasa is asking how to individualize each case of autism child. I think you've answered that, but any more quick insights if you want to give?
Ultimately, you need to learn the case taking well. First, you need to learn the general case taking well. Then you need to learn the pediatric case taking well. And then you need to see autistic children, at least a dozen autistic children under supervision.
Yeah.
Because without that, there is no way you can actually learn how to judge an autistic child.
Yeah.
Somebody who is more experienced can teach you things much more quickly. अपने में कहते हैं गुरु बिन ज्ञान न होवे. So वो mentor चाहिए होता है कभी-कभी. Without that, I don't say that without a mentor you can't grow. I did not have that mentor when I was starting to treat autistic children 16 years ago, because nobody else was treating.
Hmm.
Nobody else
Yeah.
was treating. But then it took me a lot of time. Today, I'm not the only one who's treating autistic children. I
Yeah.
don't know how others are treating. I cannot comment on that. I try to stick to Hahnemannian principles. Others might be using different approaches. But then there are a lot of people who are treating autism today. So you might be able to see children uh, and take those cases. Ultimately, the more cases you take, the more expert you become in differentiating what is common, what is uncommon. You need to learn to observe. Observation is very important. That is very, very vital in not just
True.
in autism, but all pediatric cases.
True.
Because often when I get patients, the parents try to restrain the child.
Hmm.
And the first thing I tell the parents is, let the child do whatever the child is doing.
Very important that is. Yeah.
Even if the child is trying to break something, climbing on my neck, trying to break my laptop, I let them do it.
Yeah. That is where you will get the key
Yes,
symptom.
you need to see how the child is.
Hmm.
If the
Yeah.
child is totally restrained, then you cannot judge the child. So the child
True.
should not be restrained a lot, should not be reprimanded. You can be careful that they don't break your phone or your laptop. But apart from that,
Otherwise,
you need to be very fluid. There is no one structure that you can follow. Every
hmm.
child is different. For example, when I get a new autistic child, the first thing I do is I try to wave to them. I say hi. I clap to them and call them by their name. I'll try to do a high five and high tens. And within this first 15 seconds, I get a clear idea of the eye contact, name response, command following. All of that comes out in 15 seconds.
Yeah, the core assessment that we need to do.
I get all that in just first 15 seconds, whether the child acknowledged my presence when he entered, whether the child had a proper eye contact when I called his name, whether the child looked towards me when I called the child, whether the child understood when I asked for a high five, or does the child understand the difference between a high five and a high 10. All
Yeah,
of this comes out in just 15, 20 seconds, not more than that.
right.
So a lot of diagnosis is done right at that onset. In 15 seconds or 30 seconds, I can tell where most likely this child is going to end up in which part of the spectrum.
Wow, yes.
But this comes after a lot of experience.
Experience, true.
And once you have the common put aside, once
Mm,
you have the common put aside, then you start digging for the
right, right.
uncommon. When I was a relatively new practitioner dealing with autism, I would make note of all the common symptoms and their
Mm,
severity also. Abhi, after so much clinical experience, this looks like a waste of time to me. I will not say this for everyone. If you are fresher, if you are not trained, if you do not have a 15-year clinical experience in treating autism, don't do this. But after so much clinical experience, I tend to like, okay, ignore the common. I'll not even look at it. I'll not even bother, except for the gross analysis of where the child is placed, and then I'll start looking for the uncommon, the PQRS. Uh,
exactly.
I'll ask about the behavior. I'll simply observe the child. But this, I'll say this comes after a lot of clinical experience. And when you are learning, you should not ignore the basic part where you have to take down all the common symptoms, understand the severity, understand the whole spectrum of the disease. What is the combination of symptoms? Even the combination of common symptoms can tell you a lot.
Mm,
So,
yeah.
I'll tell you an example. Uh, a child who has, for example, hyperactivity with convulsions, autism
Mm,
with mild hyperactivity with convulsions might need
mm,
cartography.
Okay. Yeah.
might need carcinogen. But other child which has hyperactivity with mental retardation with conversions might need bufo.
Ah. Yeah. So although common symptoms, if the dots are
Hmm.
joined correctly, it can take
Yeah.
you.
So
Yeah.
even you don't ignore the common. That is why I said, Hahnemann said, treat the case of the disease.
Case of the
Don't
disease. So
ignore the
true.
disease. So even I today, I say, I don't know where that kind of, again, what I say, you learn to see on the sides, you learn to gather all the kind of data that is there. So even common symptoms or the diseases or the combination of diseases that is occurring in a particular case, that can take you to the right remedy.
So true.
You just need to then uh, clarify
Hmm.
whether that
Yeah.
remedy fits, but it
Yeah.
can take you in the right direction.
Correct. Correct.
So
I
that
think
is
this
how I work.
so well said, sir. I think this also answers one more question that was asked, at how to find PQRS. You just now answered that question as well. Sir, moving on to one more
One
question
thing
that we had.
one thing I'll
Yeah.
add. In
Yes, sir,
autistic
please.
children, one PQRS that is very easy to elicit is food desires and aversions.
Yeah. True.
Do not miss those. In
Hmm.
autistic children, it's very easy to identify food desires and aversions, and they can often lead you to the right way.
Yeah. Correct.
So that is just one aspect of it. Not every case will give you that, but that gives you one more solid ground to prescribe.
Correct.
And
Yeah.
especially the unusual cravings. Unusual cravings are very, very important. For example, uh, a child, a lot of autistic children, they don't eat solid food.
Huh.
That's very common. If you do not
Yeah.
know autism, then you will prescribe on that.
Yeah. I know.
But, but that is a common symptom.
Correct.
So don't take that symptom. But if you get an unusual craving, like sometimes I get unusual cravings. Like this child likes lemons a lot.
Ah.
Now, for a young child to like lemons, for a 3-year-old child to like lemons, unusual.
That is
Another
unlikely.
patient came to me, this child likes pickles a lot.
Hmm.
A 4-year child liking pickles, what is that? This is
Yeah.
unusual because young children do not like sour.
Yeah. True.
So this
True.
becomes PQR. Milk is a staple diet for children. Somebody not liking milk, that's something significant.
Hmm. Yeah.
That's something significant. Uh, Somebody not eating green vegetables is not a PQRS in children. Somebody craving green vegetables is PQRS.
Yeah. True.
So this is, you need to understand okay, what is PQRS. A lot of times the children mother will say he doesn't eat any hari sabzi, koi green vegetable nahi khata. For a 3-year-old child to not eat green vegetables is not
It's
PQRS.
not unusual.
It's
Yeah.
not unusual. But if
So
the
true.
child says, no, he doesn't like anything, pizza, burger, cheese, bread, he doesn't like, he only eats sabzi roti.
Yeah.
Sabzi, and he needs green vegetables with
Yeah.
every
You need only
then
methi
it's
sabzi.
peculiar.
Then that is something. Yeah.
Then it's peculiar. So
Correct. Correct.
that kind of understanding you need to do.
Yeah. So true. So true, so true. Because we otherwise have that very typical idea of PQRS, if intensity is there, if mother says with intensity कि वो बिल्कुल नहीं खाता, then we consider, this is my characteristic symptom. But that's not so. That qualitative differentiation is what
You
we
have
need
to
to
look
do.
at the background.
Hmm.
Lot of mothers, when you ask about fruit desires and aversions, they'll tell
Yeah.
you he doesn't any other fruit, but he eats banana.
Hmm.
Now, the moment banana desire aversion comes, Baraita carb comes.
Yeah.
And you feel that you have hit the jackpot.
True.
But that's again not the case. The child is eating banana not because he is craving banana, because the banana is soft and it is being fed as mashed food.
Correct. So he would continuously prefer that.
Yes, that is what most autistic children prefer.
True.
So this
Correct.
is how it works. A superficial knowledge of homeopathy won't lead you anywhere.
Yeah. Correct. Very true. Both the homeopathy as well as the clinical condition that we are addressing. True. Very true. Wow. So this has been superly insightful session. I think we can just take one last question, which is there. What potency do you use for treating autism? Again, I think the answer is very clear that it cannot be one single potency that
It
comes
has
again
to
and
be
again.
individualized. It has to be
Yeah.
individualized, but most of the cases we begin with either the 30 or 200,
Huh.
and that is prescribed in liquids 50 millisieverts, liquids centesimal scale,
Hmm.
water-based solutions of centesimal scale, where the patient is taking the medicine every day, once or twice,
Uh-huh.
not as dry pills. I don't prescribe dry pills.
Okay.
Dry pills is fourth edition posology, fourth edition
Yeah.
of organ posology. The fifth edition of organ posology was centesimal scale in water doses,
Yeah.
split doses, and the sixth edition posology was 50 millisievert scale.
50 millimeter. True.
So I prefer to use either the fifth edition posology or the sixth edition
Huh.
posology. I usually do not prescribe uh, dry doses or dry pills. It's usually water potencies, water solutions of centesimal potency or 50 millisievert scale. And when we are using daily dosing, then it's usually low to moderate potency that we begin. It's usually 30 potency or 200 potency. But I can tell you that it's very, very diverse. I have cases where I have given 1 m every day. 1 m every day.
Hmm. Yeah.
Even that is required.
Yeah.
There are other cases where I give 0 by 1 every day. There are other cases where I would begin with a 6C or 12C. There are a lot of cases where we'll go by 30C or 200C, but again, this needs to be individualized.
Correct. Correct.
But
So,
if
so
you do
that
not understand, postology, then 30C is a safe potency to begin, especially if you are dosing every day.
okay. Okay. Yeah. Okay. So, so what about susceptibility judgment in autistic cases? Any quick pointers to that?
The more mental retardation you see,
Hmm.
the lower is the susceptibility.
Yeah.
The higher would be the potency, the higher would be the frequency of repetition.
Hmm. Right.
It's not a general rule. It's just a pointer.
Pointer.
It
Yeah.
it might not fit in every case, but it's like it's a gross observation.
Uh-huh. Okay. Okay. That helps anytime. So, sir, I think I am not able to see any more questions in the chat box, and plus, I think I have taken almost 2 hours of yours,
Is it too
and
much?
yeah, you didn't realize, nor did
I
I.
didn't know. I didn't know.
It's going to be midnight.
I thought it must be 1 hour.
No, exactly. But I think the way you're explaining it was so engaging and plus so very insightful. I was going to think, I was thinking that I would summarize the whole session, but then with so many insights that you have shared with us today, summarizing is such an impossible task for me. But I would definitely share one thing that what I learned or what I got to know today, very important stuff, was that A, individualization, there is no substitute for that. B, every single Hahnemannian aphorism comes into picture. C, integration wherever needed with other therapies is essential. And D, being empathetic and looking at the holistic picture, not just from the perspective of the child, but from the perspective of the entire family, is so very crucial. So thank you so much for this entire 2 hours that you spent with us and enlightening us about the whole concept of autism. You just mentioned that you never had a mentor when you started treating the cases and you had a hard time to master this particular clinical condition. But I think this one session of yours itself is going to be enough for many freshers who are going to start their journey, and probably they are looking forward to handle autism, and they have already got their mentoring through this session, I feel, if they can watch the entire session. So thank you so much, sir, for this beautiful session that we had today. And yeah, your any final concluding thoughts on this?
No, I don't think I have shared whatever I needed to share.
Yeah,
I would request all the people who have joined today to give us their feedback. Uh,
yeah,
you can write to me at my email ID manish@hpd.com, or in the comments of this presentation when it gets published. So I really look forward to your feedback also, and what has been your experience. If you can share that with me, that would be very helpful, because I'm one individual who is doing my work, but there are other people who are doing different set of work, different approaches. And if we can pool our data, if we can pool our experiences, then that would only enhance our skills as
yeah, true. True, so true. It is, there is a saying in neurology that neurons that fire together wire together. So
right.
so if we all homeopaths can start firing together at the same time, share our experiences just as you shared so openly today, I think we are going to wire together and further fire together and really bring some, really bring a lot to this particular condition apart from all the other conditions that we are doing, because this is one condition which I am personally very connected to. And we need homeopaths like you, sir. And I'm sure this session is going to make many more homeopaths like you who will be very thorough with their knowledge and will have a lot of clarity when they deal with autism. So thank you so much, sir, once again.
So
Yeah.
thank
So
you so much, everybody, for joining in. Let's
yeah.
close this live today. It has been wonderful having all of you here, and let's meet again sometime. Bye bye.
Yes. Bye bye. Take care. Good night. Thank you.